Namaste. A warm good evening to everyone present here. Hopefully, all of you are doing well. It's a pleasure for me to welcome you all. Before get start, I feel immense pleasure to share about Samiksha with you all. We have completed more than 70 sessions with enormous attendees, and thank you for being with us till now. And once again, we are here today. We all are facing a pandemic crisis right now. Mostly it is reflected in our health system. So we have had a thought that why can't we advise our Kriyakramas in OP level? So Team Samiksha presents an international seminar on Kriyakramas in OP level with certificate and paper presentation. Stars shine at night. Some stars shine at bright daylight. It's a pleasure to welcome such a star, Dr. Jayagopal Parle, Professor and Director, Atreya Ayurvedic Integrative Health Center, California, USA, for the presidential address. We welcome you, sir.
Thank you for having me. Thank you. I see my friend, Dr. Narayan Nambi. Namaskaram. I appreciate the opportunity being here on this platform. And I look forward to sharing my knowledge with my young colleagues here. So they gave me a 5-minute frame to talk to about what is the scope of Ayurvedic practice, especially the Kriyakalpas in the US. I've been practicing here for the last 16 years. Since 2005, I've been here practicing. So I will, during this next few days, you will be learning a lot of experts talking about how at the OP level these Kriya Karmas can be practiced. But I will give you some gems that have worked for me here in the US, how the practice can be simplified, and how it is definitely result oriented. There is no question about it. And how we can customize Ayurvedic, Panchakarma and Kriya Karmas to the patient needs. What do we do? Because we have a lot of interest among the people. A lot of people are interested in Ayurveda. Let me tell you this in the beginning itself, that Ayurveda is now reaching new realms. There is a new horizon. I don't want to say that Ayurveda was in dark, but Ayurveda always existed as a light, but we did not see it. So now there is a huge interest among the US population here that they are looking for Ayurveda as a lifestyle medicine, not only a medicine, but also a lifestyle that they can adopt for empowering themselves to lead a long, healthy life. So thanks to yoga has got a lot of leverage, because how yoga has worked for people in the US population, and the same will work for Ayurveda too. So this new horizon is needing quality Ayurvedic practitioners who know how they can cater to the needs of Western people. Practicing in India is a little different from practicing in here in the US. Nevertheless, the principles of Ayurveda are so broad and so extensive that we can customize and improve our quality and service to the needy here in the West. So it'll be my pleasure to share some of this information with you. I will share some cases with you, how to have cases of people who are suffering from sports injuries, people who have chronic disease conditions where Kriyakramas have really helped them. So we are here at the center that I have founded. We do almost all panchakarmas with two restrictions. One is the vamana. We cannot administer vamana here, and we cannot do rakta mokshana. So other than this, we can do nasya, we can do virechana, we can do vasti. So all other panchakarmas externally, we can do tailadhara, shirodhara, udvartana, lepas. So I will share with you all these cases of different case studies that have got a great amount of benefit from following Ayurvedic protocols. So I'll be able to share those when on the 16th, when I will be presenting. I will take this opportunity to show you that how Ayurveda can be so beneficial and how we should be acting with confidence. That is what I think we have to develop as Ayurvedic practitioners, not to feel inferior to anything, in terms of what we provide or what we bring to the table as healthcare practitioners. If we can do it with a lot of confidence, then Ayurveda will definitely work. Like Charaka says, Vidya Vitarko Vijnanam Smriti Tatparata Kriya. So if we cultivate that culture that that we have to have the knowledge, we have to have the technical know-how. So if that can be done through Ayurveda, here, not only in the West, but also in India, Ayurveda can be one of the most powerful systems of medicine, and it can help in people by masses to maintain health. Because here in the US, people are looking for health maintenance, or what we call as swastha rakshana. So health promotion or health management, and that gives us a opportunity as an Ayurvedic practitioners to use the knowledge of Abhyanga, Karnapurna, Nasya to be taught to our clients or our patients to follow Ayurvedic routine like the Dinacharya, Rutucharya. Our lot of our patients have those needs when they come. So as young Ayurvedic practitioners or teachers of Ayurveda, we need to cultivate this ability to cater Ayurveda to all needs that are not only for health promotion, but also for disease management. So I'll be able to share with you what are the processes that we do here in the clinic, what is allowed for her as for us to practice, and then how we can do it in a very hygienic, systematic, and then result oriented fashion. So these are the things that I want to share when I talk to you on the 16th. I hope that you will join me when you have a moment. And this is a wonderful opportunity that the institution is providing, this platform is providing to us. And I'll be more than happy to share with you what I have learned after being here for 15 years. Thank you so much.
Thank you, sir. Thank you for your valuable words. The essence of great leadership is influence and not authority. With this note, I wholeheartedly welcome Dr. A. Narayanan Nambi, Principal, Ashtangam Ayurveda Chikitsalayam and Vidyapeedam. We welcome you, sir.
Namaste to all. First of all, I wish happy Diwali to all. It's a great pleasure to address all of you in this festival occasion. And I really congratulate the team Samiksha for making such a long, continuous events, which will be really nurturing the budding doctors, especially people are from a different part of the state. I think this seminar really focusing on the Kriyakramas on OP level. That is really a time needed in this era too. Maybe I have been invited by the organizers maybe because of two reasons. One, I'm basically from a traditional family of Ashtavaidyas. Maybe secondly, they may be thought that I may speak something about how different in different countries they practice Ayurveda. So I'll just put light on these few things. Traditionally, as we all know well, that Ayurveda has been practicing, not like in a hospital level what we have now. Like in India, we have nearly 400 colleges. So most of course, all the colleges have inpatients. But you just imagine around 100 years before. Hardly there is no really hospitals. Maybe in Kerala, we had a Trivandrum Ayurveda college, which was 100 years before. There was no other college or other hospital set up that time. So what was the type of practice they were doing is, by and large, most of the clinicians were practicing prescribing medicines. Mostly medicines are cooked in the house, mostly that kashayams and all. Only the clinicians used to prepare medicines like gulika, some churnas, some avalehas, and a small amount of oils. Most of the time, oils also been prescribed to prepare in the house. Maybe some ghee also, depends upon the situations. So what they used to do is that whenever a patient comes in the clinic, they customize a prescription based on the need. They will prescribe a prescriptions, for example, Amrudottaram Kashayam, so Nagaramruda Haridigi in a certain proportions, and their prescription is like that, so that it describes all the details of the preparation, so that they're able to prepare and consume that medicine. Along with that, there is also a practice of giving some external application, some Kriyakramas in the house whenever there is a need. For example, the institute where I belong is Thrissur Thaikkaatmus SNA Uchachala. There are in our bureau, there are some small booklets. It's very interesting. These booklets are nothing but a small prefixed printed thing. For example, it is written for Podikirike, for Churna Pindasveda, for Navarakirike, for Shashtikashali Pindasveda. Like that, there is a prefixed, a printed one is there. So when a patient supposed to have a Churna Pindasveda or a Shashtikashali Pindasveda, there are many things. So the clinician will open this book, he take out one slip out of it, and there is a space that you can customize the herbs. Already there are written names of the herbs are already there. So you may add plus or you may delete one, like that. There are options. Even for the Shashtikashali Pindasveda also there. And there is also another set of printed prescriptions also. There is a blank prescription where you are able to write all the details. And there is also printed prescriptions that if you are using head oil, at what time it should be prescribed, at what time, how much time it should be kept, what should be the temperature of that oil, and then after a certain period of time, how it should be wiped, like that. Then labors, like that. So why I'm telling these things, because these are the beautiful way Ayurvedic practitioners were applying OPD level prescriptions, and people were really practicing it. And secondly, there are situations when the patient is very royal or very elite persons. The Vaidyan may go to the house of that patient with his disciple, go there and ask his disciple to prepare things and do the procedure by the Vaidya itself. For example, when Ramana Maharshi, the great spiritual leader from South India, had the osteosarcoma in the axilla, my father's teacher, Ashtavaidyan at Kuttanjeri, Ideal Moose was there, and P.T. Narayanan Moose. They both were staying there with Ramana Maharshi for a long period. So they prepare the Guguludikta Kashayam and whatever the medicines they want, and they do dhara to that patient at that time. So like that, there is also two type of practices. One, to prescribe the details and give to the patient, and they will do by their own. And second was with the help of the Vaidya or the help of the disciple, people receive the treatment in the house. And both these situations are unique than the today's hospital style of practices. So why I am saying this? Because there is enormous potential, enormous practical tradition we have that we can use these type of things. If we look at the traditional books of Ayurveda, like from later after Bhava Prakasha, the Chikitsa Manjari, Yoga Amritam, Vaidya Manorama, or these type of books, there are a lot of prescriptions we were able to get, which able to explain different customized prescriptions. It may be a Potali Swedas, it may be a Lepa, it may be an Upanaha. There are so many things are described, which means that OP level practice of Kriyakrama is also a mainstream part of it. Many times when people speaks that, okay, we are doing some day hospital, we are doing OP level Panchakarma, people will raise eyebrows. They think that no, in Ayurveda, we have to get it in the hospital only. It's not like that. We have so many procedures which we can receive and we have permitted to travel. Like a Yukta Ratha Vasti. We have a Yukta Ratha Vasti. So after having a Vasti, we can take an SUV and go for an off-road drive because Yukta Ratha Vasti is like that. So we can have Pradimarsanasya and go for, we can do anything and everything because Ajanma Maranam Shastam. So it can be given at any time. There is no restrictions. We have Vadadapika Rasayanas are there. So there are some misconception also there that Ayurvedic procedures, Kriyakramas, are under very strict restrictions. Of course, we have set, there are certain set of Kriyakramas need a strong restriction, but we have a lot of Kriyakramas which can be done in OPD level, which means patient may able to travel back to home or to the room or not having so much of restrictions in a regular basis. Second thing I would like to highlight at this point is that, as already my friend Jay Gopal has already wonderfully spoken some introduction about it, but I would like to say a few more things in this context, that how do we practice Ayurveda in different countries? So we have been teaching to students of Australia, to students to Russia, many European countries too, and the climate is very different. Suppose we are giving in Asia, the temperature is very, very low, like in Russia. How does it possible? Yes, it is possible. Because we may able to regularize the temperature in the treatment room. We may able to explain the type of Nasya, what we are doing, whether we are doing Shodhana, Shamana, Brahmana, like that. So it is possible that we could able to practice Kriyakrama in OPD level. So different countries, most of the countries where Ayurveda is practiced are done in OP level itself, not in inpatients level, mostly. Because many of the places, they don't have the facility to have an inpatients, and moreover, the Ministry of Health of that country may not be really permitting them to have, or they may be doing in a partial level like a hotel or a hotel extended to services. So in that perspective, OP level treatments are really have a great potential. Now come back to India, come back to our day-to-day practices. It is really essential, and it's also a potential way we could able to connect the patient. For example, if we go to a dentist, you see, if you meet a dentist there, what he does, as soon as we get into that, he examines the oral cavity, he gives cleaning, he may be doing even the periodontal, many therapies by himself or maybe with the assistant of a nurse. Why can't we think of that? Unfortunately, many of our practices, we believe that we have a unfortunate copycat of a modern medical approach, that we sit opposite to the table and just write a prescription, give some medicines and let the patient go. No, we have to change our perception in our clinical practice. Along with the prescription, definitely we could able to explore a lot of therapies. We can advise many type of LAPAs, not only to do in the home, maybe in our clinical setup itself, we should have a small area where we could do many procedures. We may do Upanaha, we can do many type of LAPAs, we can do cuppings, we can do Jaloga. So what I want to say as an introduction to this is that there is an enormous potential, and it can bring fame, it can bring wealth, it can bring relationship, it can also give great respect between a patient as well as a doctor, because a doctor is doing the procedure. So especially for the beginner, when you start a clinic, I strongly recommend you to have OP level treatment, not only just give some some patent medicines. No, try value additions like prescriptions, some LAPAs, like we have enormous products now, some Kriyakramas, even some Netra Kriyakramas, some simple Nasya, some Karnapurna, there are a lot of possibilities. And these will really bring lot of value addition in your day-to-day practice. With this introduction, I really appreciate the organizers for making such a wonderful event, and I wish us best wishes to all the participants. Thank you for inviting me. Thank you, one and all.
Thank you so much, sir. Now, without any delay, let's jump into the introduction session by our delegates. Without any delay, first, we start with the topic cupping, presented by Dr. Shine Mohan Talapulli, MD, Chief Physician at Talapulli Ayurveda Palakkad. I invite Dr. Shine Mohan sir to present the topic.
Hello.
Welcome, sir.
Yeah, I hope I'm audible.
Yes, sir.
Thank you so much for that welcome note, and it's really an honor for to present something like this in a platform, and I think it's a new start for Sameksha, and I would really like to congratulate all the organizers for this. So a happy Diwali to everyone. Let me start with that. And today, or my topic that I would choose is cupping. So it is really I would say a happiest moment, because cupping is not something that is taught in colleges, and since it is not taught in colleges, and I had like a lot of people raising eyebrows when I talk about the effect of cupping, etc. It's not regarded as purely Ayurvedic. It's something that we say it's not according to the shastras, but this is a great start, and I really congratulate the team for organizing such a mix of topics in a workshop. And to talk briefly about the topic, I was introduced to cupping in about right after my college, and my professor, like at NRI Pichavriti, Dr. Prabhanan sir, I always remember him. And the first thing he did, he showed me how cupping is done, with a coin with a camphor on top and a glass, and he puts a glass on top. That was my first introduction to cupping, and he told me how the patient felt better, and I really got curious, and I started exploring more and more, and it was not easy to get cupping sets at that time. My first cupping set, I got it through my cousin who was in Dubai, because it was not available online like how it is now, right? And with that, it has been learning on trial and error basis, and I feel that a lot of patients have been benefited, and the most important thing that I felt was the immediate results that you get with cupping in most of the acute conditions that we see in our clinics today. You have patients coming in, walking in with a stiff a spasm in the back muscles, and due to some lifting, and then when they come to us and you analyze which muscle is affected. Based on that, you apply cupping, and in 10 minutes, they feel at least about 80% relief. And the happiest thing is, many of my patients or who come to me, they would have gone to a modern medicine doctor, they would have taken a painkiller injection, and with when the effect of the injection eases, they get the pain back, and then they come to us, if there is another option. And when I do cupping with that, I've always felt that sometimes even painkillers, cupping sometimes is better than painkillers. So and it is very important that as doctors we understand and we apply these simple principles. So cupping is basically used in the principle of suction. So how can we judiciously apply the knowledge or the property or the principle of suction to help a person heal? That is a simple basic concept that we have to think when we're doing cupping. And it is something very vastly used in the field of sports medicine these days. Sports osteopaths are high on demand, especially if a couple of years back, the champion swimmer from the American team had a lot of cupping. Michael Phelps, he had cupping marks all over his body, and that's when this became a whole huge craze. So I think as doctors, it is also our responsibility to be up to date with the latest tools that is in the market, the tools that are being innovative or invented in our times, and it is for us to actually explore and understand these and use them effectively in our practice. So I'll be talking about cupping and its effect of cupping and how it can be done, and will be sharing my experiences of past 12 years, and it'll be a good for those who have already done it, doing it. I'm sure it'll be a new you will definitely get few add-ons, because I'll be talking about the how to apply cups and where to apply cups, and we'll talk about what are the principles or theories that we actually use in cupping, and definitely it will be a game changer in your practice once you start using it in your clinics. Because in today's world, we are so much used to the 7-day, 14-day, 21-day Ayurvedic treatments, and when somebody comes with so much time is a major issue today. And so if we can give something like all these Kriyakramas, and we have a lot of great authors, faculties presenting. I'm sure adding cupping to that list is definitely going to improve your practice, and so I'll be talking about that. I think that's about the introduction on the topic.
Thank you so much, sir.
Yeah.
Next, I invite Dr. Subin KJ, Medical Officer, Government Ayurveda Hospital, Malappuram, for explaining about bandaging. We welcome you, sir.
Good evening, all. Am I audible?
Yes, sir.
Okay. Happy Diwali to all. First of all, I express my sincere gratitude to Team Samiksha for inviting me in this international seminar. My topic is bandaging or bandas. In our day-by-day OP practices, case of injuries are so common. The main modalities that we can apply in the management is bandas or labas. Not only in acute cases, also in subacute or chronic cases. Even chronic cases, bandages helps. In our Shastras, bandages or bandas are very well explained. Our Acharyas just not mentioned them. They explained each and every bandage with indications, contraindications, red flags, etc. In many parts of the India, traditional practitioners, in Kerala, case of Kerala, Malabar area, they are practicing mainly on these injuries, marma practices, and they use bandages and labas, and lots of patients are there for their bandaging techniques and managements. Even though many of them don't know the basic anatomy, but the bandages works. That is the magic of bandaging and special labors using in bandaging. In our office, the patients are coming after modern management, allopathic management of fractures and ligament injuries and muscle injuries. There are so many complications. Complications like pseudox atrophy, compartment syndrome are common. But by using our bandaging methods, and especially our thylas and labas we are using in bandages, we can reduce these post-traumatic complications. In my session, I hope to cover these topics, that is types of bandages, difference in bandaging in acute and chronic clinical conditions, also for post-traumatic complications, indications of bandages in general and specific, and traditional bandages, orthotics in modern era, and taping methods, special bandages in chest, shoulder, elbow, wrist and arm, hip, thigh, knee joint, ankle and foot, specific muscle group bandaging. That's are also important. The injuries are to muscles also happens. Bandages with special oils and labas helps in speedy recovery of muscle. The muscle injury management in modern is very pathetic. So we can improve the condition by our special bandaging technique that much. The post-operative and pre-operative practices that we are using in bandaging. Application of splints, other area of interest. The number of splints, types of splints, the length of the splints, etc. are very important while bandaging. That I have to. And red flags that seems after bandaging. Then we have to rebandage and remove the bandage, and we have to rebandage that condition. That to be taken care of. These are the topics I intend to cover, and thank you.
Thank you, sir. Next, I invite Dr. Ramya Alakal, Vice Principal, Associate Professor and HOD, Department of Panchakarma, Ashtangam Ayurveda College. We welcome you, ma'am, for the presentation of the topic, Kiri.
Namaskaram all. Hope I'm audible.
Yes, ma'am.
Thank you. Due to some net connectivity, I'll not be keeping my video on. It may disturb my audio. It's raining a lot over here, so forgive me for that. So first of all, wishing all of you a very happy Deepavali. May this day inspire us to move towards more and more knowledge in Ayurveda. Maybe as Ayurveda physicians, that must be our prime motto. So the topic that I'll be dealing with this series of event is Kiri in Malayalam. Otherwise, it's the Potala Sveda. So when we speak about Kiri or the Potala Sveda, it is one among the Sveda Kriyas. And Kerala tradition has got a special affinity towards the practice of that because of maybe many reasons. The availability of very vast herbal content in the background, the modified Kerala Panchakarma that was practiced by the Vaidyas in Kerala has definitely supported or made the tradition still alive, even when the social pattern, political support, etc., was very least for Ayurveda. But at the ground, this was always happening. So we would see how acharyas have modified. When Acharya Charaka speaks about 13 types of Sveda, Ashtangradhyam comes up into Upanaha, Tapa, Drava, Parisheka, Drava and Ushma Sveda. So that Ushma Sveda, in which the so-called Sankara, Prastara, etc. comes under, that particular thing was modified using the locally available drugs, as you all might be knowing. The Shigru Patra, Chincha Patra, Arka Patra, etc., into many preparations. Now, when we speak about Potala Sveda, it is not just the Patra Potala Sveda, of course, texts like Chikitsa Manjari, Yoga Amritam, Sukha Sadhakam. These texts do have more and more mentioning about different varieties of patras to be used for different clinical things. But the fact remains that many dravyas, when Acharya Charaka speaks about Pinda Svedas, it includes Karisha to be used among Pinda, Mamsa to be used, Masha to be used, Shali to be used, Payasaihi, Krisharaihi, all these things to be used for Pinda Sveda. The fact remains that it is actually the dosha dominance in the background that decides which type of Pinda Sveda need to be taken care of. So when the division of Sveda into 4 classical format of Tapa Sveda, Upanaha Sveda, Ushma Sveda, Drava Sveda, that itself indicate how the Amshamsha Kalpana of dosha in the Samprapti of the Rogi basically decides which kind of Sveda that we need to do into the patient. So when it is Pittanubandhatam in the background, Drava Sveda has to be preferred. At the same time, when it is Vata Kabha Kabhavada, Ushma Sveda can be the possibility. Upanaho Bandhanaha, which is more specific towards Vata plus plus, and Tapas Sveda, which is more and more Ruksha, more specific towards Kapha plus plus. So unless and until we understand the Samprapti to a great extent, selecting the most specific kind of Bahiparimarjana Chikitsa is a longer dream as such. So primarily, we definitely need to understand the so-called Hetu Vishesha and the Samprapti Vishesha, which Roga Marga, which dosha and dhatu level it has been involved. And according to that, we can be more precise and specific in selecting the Brahiparimarjana Chikitsa. So the usual trend of somebody making a patient admitted in Ayurveda hospital, and they have a notion, anyway, if we get into Ayurveda hospital, any 21 to 28 days is a must. And the usual thing, you start with Podikiri, go for Abhyangam, then Alakiri, then end with Kayasekam or Shastik Vendasvedam. This is not at all intended, I think, in Shastra. Rather, observing the Samprapti and the needed thing at that particular moment can be done. And I'm sure we need not have, of course, the chronicity of the disease is a part, but we need not take so much of so long if we go for the specific kind of Potala Sveda, or if at all the patient is indicated for Parimarjana Chikitsa within 10 to 40 or 10 to 12 days or even below 10 days, we'll be able to get better results. As we all know, where Sveda has to be applied, definitely the indication has to be taken care of, and where Potala Sveda has to be taken care, that has to be our specific understanding has to be there. And among Potala Sveda, which is the dravya to be used basically, and which could be the medium, should I go for Kola Kulatha the Churnam or Kulatha or simple Kulatha? Should I go for Dhanyamlam as the medium, or should I go for a Dashmula Kashayam to be dipped? So all these things basically depends upon Amshamsha Kalpana. And the fact remains that all our acharyas have always done what, observing the things around them and utilizing them for doing whatever procedure can be done. So using Karisha, dried cow dung is very, very effective in some clinical condition, and rural places need to use this because all our Kriyakramas has to be more and more cost effective. Unless and until we make it very cost effective and available to an ordinary man who goes for daily work or something, Ayurveda must be affordable to them. It's not like Ayurveda treatment, you need at least 3,000 rupees per day with room rent and food and all treatments, so that even a middle class person cannot afford it. That should not be our norm. So such lot of improvisation like Tunikiri, Tunikiri is Vasasveda, Tusha Busha, that is Tavidagiri, etc., which is very cost-effective materials we can use in practice according to the avastha. So I'll be deciding discussing these areas when I speak on the topic. And one more important thing which I would be emphasizing is the usual thing is 7 days, 7 days, 7 days for all Kriyakrama. Nowhere in Shastra it has been told as 7 days or 14 days. Rather, it is the Samyak Lakshanas that has been given as a guideline for all of us by the in Shastra. So observing the Samyak Lakshanas and deciding whether we have to stop Rukshana, move on to Snigdha, how to observe, when to observe, all these things is very important. So observing Samyak Lakshanas in our day-to-day practice is very important. Otherwise, the specificity of our Kriyakrama will be somewhere distorted. So observing Samyak Lakshanas, selection of the best treatment, which medicine to be selected. I think all these areas would be emphasizing. I'll be emphasizing on these areas so that, when you sit in an OPD practice, as Dr. Nambi sir had already told, always, especially these portala Vedas, Kiris need not be something like always it has to be done in the IP level only. You can make the patient, you just educate the patient of how to do the procedure, local procedure and all they can do at their home itself. And all these things in our prescription, we can add a small Kriyakrama as a part of it, which will be more cost effective, at the same time more efficacious as far as the clinical outcome is concerned. So I'll be discussing all these areas in my presentation. So all my regards and best wishes to the organizing team for the best conductance of the program. And I'm sure many would be benefited when we discuss these ground realities from clinics. Thank you all.
Thank you, ma'am. Next, we jump into the topic, Rakta Moksha. I cordially invite Dr. Chandra Maulishwaran, Principal, Ayurveda College, Coimbatore, Tamil Nadu. We welcome you, sir.
Yeah, thank you, Team Samiksha. So it's a great pleasure and honor to be part of this, seminar. And the topic selection is really nice. Why? Because as all other speakers, already told, like Nambi sir, Ramya ma'am, and even other speakers, it's very important. It is not that everyone can come and stay, because the world is changing and we have to change also. So recently I was discussing with my managing trustee, because we are planning to open a center in UK. So that basic idea was the same, like people cannot come and stay like IP, but at the same time how best we can do these kind of treatments with the availability of the in some other places you may not get all the resources. So it's very relevant nowadays, and it is very as already Ramya madam told, like with the simple resources, available resources, how best we can utilize for the betterment of the patients is always a good thing. So in my topic I'll be speaking about because see, Rakta Moksha, when it comes to Panchakarma, there are some advances also in some especially when it comes to Rakta Moksha, about the instruments. Because like nothing wrong in going with advancement. That's what I believe, because I remember when I joined in my PG in 2003, 2004, I in Cheradurti, there was a this teacher and student interaction seminar was there, and it was like CMV was conducted by RAV. So that time, people, teachers from Trivandrum, all those places also came. I remember Vinod sir was there. So we were talking about this topic. Then I told in Vimanasthana Charaka, it is told Charaka, Chakrapani sir, Chakrapani Acharya told that Kritrima Upadanena. So then it was a fruitful discussion was there whether we have to adopt these changes, all those kind of stuffs. So I always believe in adopting the changes because that's how the universe evolved. So adopting the change is very, very important according to me. So I'll be speaking about those kind of things also, and in the OPD level, how we can practice. And already somebody is going to talk about the cupping. So I have certain instruments, I got it from China, and it's very simple technique to be used. And definitely, it can be like if somebody has the back pain or spasm, just like that you can use. And nowadays, I know one of my patients, she taught me in Germany, and you can see it is coming up. Actually, they take a blood from your any part of the body, and they will just inject to the place where you have the pain. It is really, such kind of things are available. I'll be touching those kind of things also. So I'll be, teaching you, or I'll be sharing rather than teaching. I'll be sharing my little knowledge, whatever I have in this Raktamokshana, and how to practice like Prachana or Puttana in in the OPD basis. You don't need, you don't need to admit the patient for a certain simple skin and other things. So I'll be, sharing all those stuffs. So hopefully, I can do my best. And once again, I thank the organizers for giving me this opportunity. Thank you very much. I wish them all the best. Thank you.
Thank you so much, sir. Next, I cordially invite Dr. Praveen PP, Deputy Physician, Adivaidya Shala Kottakkal, for explaining about the topic Agni Karma.
Good evening, all. Happy Diwali to all. I think I'm audible, right?
Yes, sir.
Okay. So first of all, I thank the organizers for giving me opportunity to talk regarding the Agni Karma, a wonder procedure, a best procedure, a cheap procedure, an easy procedure, but same time a procedure that can make you in trouble also, right? So pros and cons. So I'll be talking regarding the Agni Karma, that what we can do in our OP level. Okay, so most of the Ayurvedic doctors, most of the just newly starting doctors, those all will get pain. So our main headache is to manage the pain. And coming to the pain management, the role of Agni Karma, the extensive role of Agni Karma that we have to talk, that we have to learn. And the second thing, the emerging branch in Ayurveda is cosmetic branch, right? So coming to a cosmetic aspects, coming to management of Kshudra Yoga, that is very much important, even though it's Kshudra, but it gives a lot of importance to the patients. How we can improvise our management through Agni Karma, like skin warts, corns, and many other conditions, skin tags, molds, masha, tilakala, whatever you say. And very surprisingly, many of the keloids, as all we learn, usually keloids asadhya. But in my practice, I've seen many of the keloids respond well. Many of them may not. Usually the keloids in the chest region, they doesn't respond well. But somebody may develop keloids without any reasons, usually in the back of shoulders or in the iliac region, sometimes in the butts. Such keloids, round keloids, they do respond well. So it's very wonderful. Why? Because management of keloids in all other systems usually fails. Then we can provide them some kind of support with Agni Karma. So even though it is not completely curing, it reduces in size, it reduces its progression. So such things we can talk. Now coming to the field of musculoskeletal, management of pain, first thing, you start from the foot, the metatarsalgia, calcaneal spur, Achilles tendon. Coming to knee, wonderful results you can get even in acute cases, injuries, chronic cases, not in inflammatory conditions. Even in some ACL tears, we recently tried, just after 7 days, the Sadhyo Vranatva is just over. We tried and it improves the range of motion. So to remove the stambhatva or the stiffness, it helps. Coming to the ITBS or in low back, neck pain, in all kind of musculoskeletal condition, and very interestingly in shoulder injuries, RCTs, biceps tendinitis. The most of the whatever we say the Vata Roga, even though it is not purely Vata Roga, most of the conditions which you usually come across, which you usually tackles in your OP, along with the medicines, what you can do. All options are here. The Samiksha is very beautiful. The beautifulness of this seminar is all the options, whatever you can do in your OP, that they are giving in a nutshell. So all these things we can talk, and the procedure as such, preoperative, operative procedure and post-operative procedure, and what are the indications, what are the investigations you need, and what are the most important contraindications, and what are the common instruments, and what are the type of Agni Karma, Ruksha Agni Karma, Snigdha Agni Karma, where, when, how you have to do, when we can do. Okay, what are the medicine that you can give along with Agni Karma, and what are the easiest methods? Okay, all these things we can talk in the upcoming classes. Hope it will be very useful to all of you. And thank you once again, the organizers, for giving me opportunity. Thanks all.
Thank you so much, sir. Finally, I invite Dr. Sangameshwar Doddagowda, Assistant Professor, Department of Panchakarma, SS Ayurvedic Medical College, Haveri. I cordially invite Dr. Sangameshwar, sir, for explaining about the topic, Nasya. We welcome you, sir.
Yes, ma'am. Am I audible, madam, please?
Yes, sir, please.
Yes.
It's visible, sir. Sir, it's not audible.
It's audible now, madam?
Yes, sir, it's audible now.
Yes. Madam, Om Shri Dhanvantaraye Namaha. Myself, Dr. Sangameshwar, ND from Assistant Professor from SSI Ayurvedic Medical College, Haveli, Karnataka. Deepa Jyoti Parabrahma, Deepa Jyoti Janardanaha. Deepo Harati Me Papam, Deepa Jyoti Namostute. Happy Diwali to all the dignitaries and the participants and all the organizers. With due respect to all the dignitaries and the organizers, I feel proud and happy to be part of Samiksha International Seminar on Kriyakramas, of which is going to be held, which is going to be focused on the OP level practices in the general practices of Ayurveda. Who are all the Ayurvedic faculties, who are all the Ayurvedic doctors practicing in the rural places of all the India, all over the India, and who is the procedures of Panchakarmas which are all done on OP basis. It's happy and interesting topic. It's also informative topics which is going to be held throughout these sessions. I feel very much happy to listen, happy to involve, happy to be part of this, the Samiksha. And topic which I am going to speak is on the Nasya. Nasya is a administration of different types of the medicines, which the Nasya passage in the systemic manner. It is administered in a wide variety of diseases, and especially in Urdu Chaturdogata Vikaras, the Nasya is categorized into many types according to the different acharyas, and in present day, in present era, the present eras, in different clinical conditions. Administration is in many forms like Marsha, Pratimarsha, and Pradhamana, and Avapida, and the Dhuma, as a Nasa Pan also. The diverse form of administrations are not so familiar and informed. All along the country, various texts or journals has been searched and screened over it to get the details regarding the different types of Nasya Karma, which is in practice, clinical practice currently. Nasya is observed form of a research study, point of a view, and it's officially noted. And also different medicinal property forms of powders and the oils and aquases and different methods and actions through nasal passage. Overall, the procedure requires that the universal proper informed executions is needed in the clinical practices. Though the Nasya Karma is a therapeutic procedure in which the drug or the medicated oil or the ghee decoction or the powder smoke is administered through NASA, it acts well. It has got a clinically wide focus and wide result oriented Panchkarma procedure. And it's also, I'm going to focus on the Nasya, which is very easily, conveniently, with a less cost effective, with a result oriented Panchkarma procedure Nasya. And you may remember the incidents in the pandemic, at the time of the pandemic, which was helped all over the world through the Nasya, through the Nasya procedure, through these Nasyas, the all the pandemic in condition of the pandemic, while in times of an COVID, which the Nasya helped much more, which was the Nasya was clinically administered and Nasya was advised by all the Ayush doctors. And also, my clinical practices as I am in the rural places to a public, to a patients, to a people has no time now and asks for the easier and the fast reliefs for the with the treatments which is done on the OPD basis and which they may get the relief with their symptoms very much fast. They are very much eager to have the results through the OPD procedures. So in that way, these seminar, which is Samiksha, which has got the Kriyakramas, has got the very important aspects, important things. So I will be going to present on the Nasya topic with my case presentations, with my clinical practices, with the clinical studies also, which have been done throughout my practices. So I'm really, finally, I thank the organizers and all the dignitaries and all the participants. Thank you. Thank you for an opportunity which was given by me. Thanks to Samiksha team.
Thank you, sir. Thank you so much. So our sessions are come to an end. So thus we come up to the end of this conference. Before winding up the session, let me remind you all, we have been extended the date of registration for international seminar up to November 10, 2021. Those who are interested, join with us. Please make it fast. When it comes to a pleasant end, I'm very happy to wind up this conference because conferences are always made to know in-depth knowledge from one point of view to many. Today, we had a number of delegates with us and everyone have shared their own style of thoughts. On behalf of Samiksha and its entire fraternity, I feel proud to propose a vote of thanks. I extend my sincere gratitude to our shining star, Dr. Jayagopal Parle sir, for sharing his precious time with the presidential address. Next, I express my sincere gratitude to Dr. A. Narayanan Nambi sir, a man with great vision and mission. Thank you for inaugurating this conference, sir. Next, I express my heartfelt thanks to Dr. Shine Mohan for giving us an idea about his topic with a minimum words. Thank you so much, sir. Next, I express my sincere gratitude to Dr. Subin sir for explaining about the topic bandaging. Thank you for sharing its importance with us. After that, we were the part of the topic Kiri, which is beautifully explained by Dr. Remya ma'am. I extend my sincere gratitude for your presence, ma'am. It gives me an immense pleasure to extend my sincere gratitude to Dr. Chandra Maulishwaran sir for the brief explanation of the topic Rikta Moksha. Thank you so much, sir. And I extend my heartfelt gratitude to Dr. Praveen sir for sharing his time with the topic Agnikarma. Finally, I extend my sincere gratitude to Dr. Sangameshwar Daddagowda sir for his gracious presence with the topic Nasya. And once again, I extend my sincere thanks to all our delegates. Thank you all. Finally, I would like to thank all the participants for participating in such an international conference. Thank you all for making it possible. Thank you, sir.